Hey everybody, how you doing? Bill Colarulo, Grungo Colarulo. I'm very excited today. We are joined by Dr. Nickolas Tyris, a board certified rheumatologist at Advocare Rheumatology. They have 4 locations throughout southern New Jersey: Mount Laurel, Voorhees, Sewell, and Vineland. We wanted Dr. Tyris to come on to talk about the COVID-19 pandemic, and specifically with regard to the hydroxychloroquine, which is being thrown around in the media as a medication that can be used for COVID-19. It is, in fact, a rheumatology type of medication, so we wanted to bring Dr. Tyris on. Dr. Tyris, thank you for joining us.
Bill, thank you so much for having me. Glad to be here.
And to let people know a little bit about Dr. Tyris's background, he graduated from NYU, received his medical degree from Georgetown School of Medicine, then went on to complete his residency at the University of South Carolina and his fellowship at Drexel University Hahnemann Hospital. Pretty impressive.
Thank you. Thank you. Glad to be here.
So before we get into some of the medications and different things, this COVID-19, I'm hopeful that most people are taking this seriously now. But for those out there who are still doubting the seriousness of this, can you just touch on that? Is this something we should be taking very seriously?
Bill, absolutely. I mean, I don't mean to promote more doom and gloom here, but this is real. This is spreading quickly. It's growing exponentially. And the changes and the things that we do now are going to significantly impact how this disease spreads and how quickly we can flatten the curve. So it's very much real, and it's very much affecting all of our lives right now.
And are there any recommendations you have on ways that we can minimize the risk of catching COVID-19?
Definitely. First, I want to say that the best source for information is cdc.gov. That's updated regularly and gives clear information in a question and answer format regarding what to do in various situations. But let me just give you a few tips here. And you've probably heard this multiple times in the news, 100 times, but 101 times is even better. So certainly wash your hands often for 20 seconds at a time. Even if you're at home with the same group of people that you live with, even in that scenario, wash your hands every few hours. Avoid touching your eyes, nose, and mouth. When you do have to sneeze or cough, make sure to sneeze into your elbow. A lot of us have already started working from home. And if you're a non-essential worker, do that. If you need a note from your physician stating that you should work from home, don't hesitate to reach out to your physician regarding that. When you're working from home, make sure to disinfect your work area, and that includes your keyboards, your phones, your cell phones, anything that you're coming into contact with. Then regarding social distancing, first of all, you should stay at home whenever possible. Go out though, certainly when you need to. Everybody needs fresh air, everybody needs exercise. So as long as you're maintaining an appropriate distance, you can still do those things. Shop for groceries and things like that. Go to your doctor's visits. If you have a loved one in the hospital, at this time, this would not be the best time to visit them. And certainly if you had an elective surgery already scheduled, if it hasn't already been postponed, this would be a good time to postpone it. Certainly reach out to your physician to see if that would be appropriate.
Great tip. So no picking your nose is what I'm taking from
Not at this time. Wait a couple months. Yeah.
So I wanted to talk to you about, obviously you're a rheumatologist, and my understanding from what the limited knowledge I've read on the media and on the internet is about this hydroxychloroquine. So can you tell us a little bit about, first of all, what type of medication is it, and why is this now in the media with regard to coronavirus and COVID-19?
Sure. Hydroxychloroquine, or the brand name Plaquenil. This is a medication that was initially used as a treatment for malaria, but is used by rheumatologists now for the treatment of many autoimmune diseases, including lupus and rheumatoid arthritis. So this is a maintenance medication for those diseases. Now, there's been some small studies that have shown that hydroxychloroquine, with pretty good efficacy, can be used to possibly treat COVID-19. Unfortunately, recommendations regarding that are still very much premature. To date, there's a small study out of France that had some design issues that showed some promise, and there's also some unpublished data out of China that's also showing some promise. But at this point, we don't have rigorous studies where we can make strong recommendations. So I would advise my colleagues to hold off on prescribing the medication right now for reasons other than autoimmune diseases until we really have more information. The other issue that we're running into now as rheumatologists is our patients who were on these medications for their autoimmune diseases and have been on them for years, now because of the shortage are having difficulty filling their medication. So it's becoming more of an issue. So I would say at this point, hydroxychloroquine, we cannot definitively say that it's a treatment for COVID-19, and certainly more studies need to be presented before we can make any conclusions like that.
Interesting. You mentioned some people aren't able to get their medications
Yeah,
who need this hydroxychloroquine.
right.
What about other types of medications? Should people be stopping taking other types of medications right now?
Sure, and this is a very common question that I get on a daily basis, especially in the rheumatology world, where we use a lot of medications that alter one's immune system, including these disease-modifying anti-rheumatic drugs and biologics. In general, and now these are gross generalizations. Having somebody, if somebody has uncontrolled autoimmune disease, that's actually a greater risk for contracting any type of infection than having well-controlled disease with a biologic medication. So as a generalization, I would say continue your medications. But really what should be happening is this should be a shared decision on a case-by-case basis between a patient and the prescribing physician. So at this point, do not hesitate to reach out to your prescribing physician to ask them this exact question, whether a particular medication should be continued or not. You know, this is really a time where we should be over communicating, and that includes with our loved ones, family members, coworkers, bosses, and certainly our physicians. So reach out to your physician, ask them this exact question, and determine what's best for you.
It's interesting because you talk about how reach out to your doctor. You know, I know a lot of people are nervous to go to their doctor's office right now as fear of catching something.
Sure.
If someone wants to contact their doctor, they want to schedule an appointment with their doctor, whether it's coronavirus related or not, you know, what do you recommend the best way to do that?
Sure. Well, physicians in general, outpatient physicians, have already adjusted their workflow to incorporate appropriate social distancing and things like that. So the first thing you should do is reach out to your physician and see what they're offering. In a lot of cases, you can schedule a televisit where you'll have either a video conference or a phone conversation with your physician, and it'll be similar to how you would conduct a normal face-to-face visit. In situations where a face-to-face visit is necessary, whether that means you need to have a procedure done or a physical contact is necessary, that can still be arranged. Doctors can still see you. I can tell you some of the things that we've incorporated in those situations. So we do not keep patients in our waiting room at this time. We have them wait in their cars if there's any delay in getting them back into the patient room. And then we minimize the amount of time that are spent that a patient actually spends in the office. So we've already made changes, and doctors across the country have made changes. So first and foremost, reach out to your physician and determine whether a face-to-face visit or a televisit is appropriate for you. Then if you're sick, if you have a fever, if you have a cough or any symptoms like that, call your physician and let them know before coming into the office. They'll then direct you whether you should still come to an appointment or whether your appointment should be rescheduled or changed to a televisit.
Well, doctor, I know you're a busy man. I appreciate you taking some time to jump on with us today. I don't want to take up too much more of your time, so I'll let you get back to the front lines here. And I know I speak for everyone, not only you, but all medical professionals. Thank you for everything you are doing right now for our community. and we appreciate it from the bottom of our hearts. Thank you.